Here's what you need to know about phosphorus if you have kidney disease or are at risk of kidney disease. I'm Michelle Crosmer, and I'm a registered dietitian and specialist in renal nutrition. In this video, I'm going to walk you through the 3 most important things you need to know about phosphorus for your kidney health. Number 1, you need to be aware of and mindful of the phosphorus you're consuming in your diet, even if your blood levels are not elevated. Why is that? So blood phosphorus levels typically do not become elevated until late stages of kidney disease. This is because the body is able to compensate early on and keep blood levels normal, even if someone's consuming a high phosphorus diet. Why is that? So there's something called fibroblast growth factor 23, or FGF23 for short. FGF23 is a bone-derived hormone that plays an important role in regulating phosphorus and vitamin D metabolism. People with kidney disease have higher circulating levels of FGF23, and FGF23 also increases with higher phosphorus intake. And the reason this happens is because the FGF23 is compensating for that high phosphorus intake, and it's increasing urinary excretion of phosphorus so that blood levels don't increase. The reason we don't want high FGF23 levels is because it can impact cardiovascular health, inflammation, and even mortality. And these implications occur in people with kidney disease, but also in the general population. So that's why FGF23 is something we don't want to see high numbers for. It's not something that's tested for. It ultimately means that phosphorus matters even if your blood levels are not elevated, because people can often have high levels of FGF23 in early stages of kidney disease, which can make them higher risk for cardiovascular outcomes, more inflammation, which can lead to faster kidney disease progression. So the second thing that you want to know when it comes to phosphorus is you don't need to count how many milligrams of phosphorus you consume each day. Most of the time, you will not be able to accurately calculate this because most food manufacturers don't put it on labels because it's not required. And also, different sources of phosphorus are absorbed differently in the body. So phosphorus coming from plant sources like nuts, seeds, legumes, and whole grains are in the form of phytic acid. Humans lack the phytase enzyme, therefore only about 50% or less of the phosphorus naturally present in plants is actually absorbed. Phosphorus coming from animal sources like meat, poultry, eggs, fish, and dairy are absorbed about 60 to 80%. So let's compare this. A half a cup of cooked black beans contains 120 milligrams of phosphorus, but only 30 to 50% of this is absorbed. So 60 milligrams or less of the phosphorus from these black beans is actually absorbed. Now, in comparison, 1 ounce of cheddar cheese contains 129 milligrams of phosphorus, and we know about 60 to 80% of that will be absorbed, so that's about 77 to 103 milligrams of phosphorus being absorbed. So you can see the cheddar cheese and the black beans contain similar amounts of phosphorus, but more is absorbed from the cheese than the black beans. Now, the next form of phosphorus is in the form of additives, and these phosphorus additives are absorbed about 90 to 100%. This type of phosphorus is used as a food additive to preserve the food or enhance the flavor of the food. While you'll see the phosphorus additive listed in the ingredient list, the actual milligrams of phosphorus is usually not included on the label. So for this reason, it's recommended to avoid foods that have phosphorus additives, limit animal sources of phosphorus, and you typically don't have to worry about the phosphorus that's coming from whole plant sources since it's minimally absorbed. Now, the third thing that you want to know about phosphorus if you have kidney disease is you should check every food label for phosphorus additives. That way you can avoid excessive phosphorus intake, especially coming from phosphorus additives. So if a product contains the food label, turn it over and look for the ingredient list. Even though milligrams of phosphorus is not absorbed or is not listed on the food label, you will find out if phosphorus is added to it by checking the ingredient list. So just scan the ingredients and look for any word containing PHOS or PHOS, and this will be a phosphorus additive. Some examples are phosphoric acid, disodium phosphate, anything PHOS. Phosphorus additives can be found in many different packaged foods, but are commonly found in baked goods, boxed pancake and bread mixes, dark-colored sodas, other beverages like teas or sports drinks, processed cheese and vegan cheese, enhanced and processed meats, prepared and frozen meals. Added phosphorus can truly be sneaky, but there are always better options out there. You want to investigate while you're shopping and check the label for everything. So there you have it, the three most important things to know about phosphorus if you have kidney disease. To recap, number one, you need to be aware of and mindful of the phosphorus you are consuming in your diet, even if your blood levels aren't elevated. Number two, you don't need to count milligrams of phosphorus in your diet. Just know that phosphorus is absorbed differently from different sources. A lot of plant foods that are deemed high in phosphorus are actually much lower when you take the bioavailability from plant sources compared to animals into account. And number three, check the ingredient list of packaged food and avoid anything with PHOS or FOS additives. Thanks for listening. This is Michelle with Plant Based Kidneys Kitchen. Make sure to like, share with your friends, and subscribe to the channel, and I will see you next time.